you that don't know me already, can you guys see my PowerPoint, by the way? Give me a thumbs up.
Yes.
All right. So if you don't know me already, you guys can follow me on Instagram at PA_Pappas. I have the same thing on my TikTok, which I just got recently. Haven't really done anything fun yet on it, but I do plan to do some silly things. I don't know. But yeah, it's the same name. And then I can be reached by email at thepacorner@gmail.com. Once I get into this program a little more and tell you about it, you'll probably understand why I have really delayed response time. So I apologize, especially this month. But after this month, hopefully a little bit better. So yeah, all right. So I grew up in California. First of all, my name's Chloe Pappas. I don't remember if I even said that. But I grew up in California as well as actually in London, in the UK, and I spent my summers in Cyprus. I am actually 100% Greek Cypriot, and my mom's family came from Cyprus. My dad's from Greece. So yeah, that's my mom in the right upper corner looking like a fox, my dad in the right lower looking like a dork, and my grandmother on the left. I'm not that sweet in that dress right there. I don't know. Just fooling everyone here. Oh gosh, can you hold on? There we go. All right. So my undergraduate training, I went to UC Santa Barbara. I graduated in 2013. I majored in biopsychology, which I don't know if every school has that, but it's basically both biology and psychology, focusing mostly on like neurology in the brain. Sorry, there's like knocks everywhere and I don't know if they're for my door or not. So I just like found this room. All right, so I wasn't really involved in my school. I was in a sorority, it was called Alpha Phi. We did a lot through my sorority as far as volunteering goes. So I had so many volunteering hours coming out of school. I also joined some sort of health association. I don't remember the name now, but I did a lot with that. We also had in Santa Barbara Doctors Without Walls, where we actually just kind of set up like clinics essentially in parks, and being completely unexperienced, I was just in charge of like taking vital signs. But that was really cool. It was mostly homeless people, which we have a lot of in Santa Barbara. And through that, I was able to get involved and like set up a lot of other like volunteering opportunities through that. I also did a lot of research. It actually came with my classes. I had to do a lot of research because UC is pretty research heavy. So I did a lot of that as well. All right, so I'm sure, I don't know how many of you are pre-PA or in PA school. Sucks because I can't see you. I can't have you raise your hand right now. But these are my Casper Stats. I have these on my Instagram as well, somewhere in there. I never ended up doing a GRE. I had like a bit of a family emergency. So I kind of just bit the $100 at the time and didn't do it. So I had to apply to schools that didn't have the GRE as a recommendation, although now I know it's another form of testing. So anyway, you heard about my major. My GPA was, meh, like it wasn't amazing. I did a lot of socializing in college, we'll call it. So that was my final GPA. It was 3.24. Then I did a bunch of postgraduate training at like a nearby junior college. It had a really good science program and like anatomy program. We had cadavers and everything, and I actually taught in a cadaver lab for a while. But there I got a 4.0 because I like wasn't socializing and focused a little more on school. So my overall GPA for CASPA, if you'll see, it came up from a 3.24 if I didn't do the post batch to a 3.39, which was super helpful, I think. I'll talk about my healthcare experience actually a bit later, but I also had some licenses you can see there. My letter of recs, for anyone interested, I got one from an anatomy professor that was actually in my post batch program, and 2 healthcare professionals. I actually ended up working with both of them, which I'll talk about. So in my timeline for submission, I worked on my application before submission, maybe like 3 months. I worked on it a lot, like some days like up to 5 hours on my paper. I think I'm a bit of a perfectionist probably, but anyway, so I submitted July 2nd. I applied to 16 schools, which seems insane, but someone told me to just go big, which sucks because it costs money, as all of you remember or are experiencing now. But that's just, I went for it. I only wanted to do this thing once, right? And I added, it says I added a lot last minute that didn't have any fees, or supplemental applications. But I ended up getting interview invites for like 7 to 9. I don't really recall. I attended 4 interviews. The first one was in the East Coast, and I really liked the school, but I'm actually so glad I went anyway because it was great practice. I had a very embarrassing interview moment where I fell out of my chair. And expecting the 2 guys sitting there to laugh, but one of the guy interviewing me was so straight-faced. It was absolutely awful. But anyway, great experience. And then I ended up my 4th one, which I got invited to very last minute, was the school I chose. I was like their last option to invite when someone canceled. Bonus for them though, they got me, right? Okay, so what else? Yeah, I got waitlisted at 2 interviews, later accepted to 1, but I ended up going to the 4th one. What sucks about that is I ended up paying for some like hold your spot fees. Yeah. So if you guys haven't applied yet, what I'm trying to get across is it's an expense. It's a big expense. So some people say, oh, just apply this year, see if you can get in. That's not really my recommendation. I always tell people don't apply until you think you are like ready, because it sucks. And most of us have these pre-PA jobs that don't make that much money. A lot of us have families, kids maybe that we're supporting. So I kind of say, do it once. Maybe you don't apply to 16 programs, and that's perfectly fine. But I think it's better to just wait till you're like ready. Shit. Sorry, 1 second, guys. All right. Yeah, and interviews start in November. I literally interviewed from November to March. I had them so scattered about. My MBKU one was in like late February or March, which is the school that I chose. So here we are. Healthcare experience. I ended up getting EMT certified after graduation from undergrad because I just had no idea what to do as the next step. I don't come from a family of doctors or PAs or anyone that could have like guided me whatsoever. Couldn't find a job as an EMT because I was being too picky. Ended up working in physical therapy, and then eventually I found an EMT gig, and the biggest thing that I did was scribing. I scribed for like 2.5 years or so. So you'll see my average patient care hours were 3,000. I know they've kind of switched up the guidelines for that for you guys, but anyway. And then blah, 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 a lot of volunteering experience, shadowing experience, which I think you guys are basically going to be getting today, which is cool because, Did any of you guys get to shadow at all ever? You can tell me in the chats, like in real life before this started. But I'm trying to keep the chat open while still having you guys. Hold on, let me just maneuver this. Okay, there we go.
Oh, Chloe, really quick.
Yeah.
The way we've been doing it is we have people put questions in the chat, and then you can answer them all at the end. So
yes. Yeah, go ahead and do that. I will definitely, because I'll mostly be doing Q&A here at the end. So as you think of questions, just put them in for sure. I'll skim through this. Yeah, so I went to PA school at Marshall B. Ketchum, which is in Fullerton, California. On the bottom left is where we did our master's capstone project, which you will all have to do or have done already. My program was 15 months of didactic, 12 clinical months. Our rotations were 6 weeks long. We actually had like a pass-fail kind of thing. Wait, so are you guys applying to PA school? Yeah, okay, cool. All right. I wasn't sure like where we were at with who's tuning in for this thing. So MBKU has this really cool system where they actually have a pass-fail. However, the passing rate is 80%, which is great. You don't really get grades. You do get a percentage of your test, like you know what you got on it. But overall, you either pass or you fail the class. That's a big benefit. The cons are, you have to get 80% or higher, which is tough. And also there's kind of like a 3 pass or fail tolerance policy, you could call it, where, if you keep failing exams, like you do get booted or have to start over. And that happened like to 2 people in my class. They didn't have to repay for their didactic year. They just had to start over. Anyway, and we had modules. Have you guys heard of module-based learning? Yeah, maybe I'm seeing some nods. So basically what that means is we go by systems. So we started the year with like anatomy, then we went to physiology, just as a very, very general basic, like they're just spraying water through a fire hose quite literally because you're covering all of anatomy in like a week. But since you've already had it, hopefully it's like a bit of a review. And then they move on to like dermatology. And within that 2 weeks of dermatology, you'll get more focused anatomy and physiology, and you'll go by like disease processes. You'll learn the physical exam for it, what kind of questions to ask. You'll look at a bunch of rashes. You'll learn the treatment and the pharmacology of dermatology, basically. So it's really great, honestly. And then they organize it to where you build on each thing. You know, they don't start you directly into like renal system, for example, until you've had cardiology and things that'll help you understand that system, which is great. No, I don't want to update right now. Oh my gosh, guys, I'm sorry. My computer's trying to update. Perfect timing. Get out of here. All right. I want to say I'm usually much more put together than this, and I am, just not this month. Again, I'll get there to explain why. Anyway, so yeah, that's our didactic year in a nutshell. Our clinical year, we have 6-week-long rotations. Most programs have 4-week-long, and they get more electives. When I was applying to school, getting electives was really, really important to me. So I was really bummed to find that MBKU only gave us 1 elective. I will tell you now, it does not matter. Because, you know, even if it's like a surgical specialty, if you're in general surgery, especially at a hospital that has those specialties, like when I did my general surgery rotation, I hopped in on a lot of cardiothoracic cases. I saw open heart surgeries. I mostly watched. I didn't quite like get involved as much, but you know, as a student in those kind of subspecialties, you're not going to be doing much anyway. You're going to be doing a lot of shadowing. You know, if you go into plastics, they're not going to let a medical student in plastics do things. You know what I mean? Because you need, the whole point of that subspecialty is to get the best of the best. So I think that you're just as good off shadowing. I don't think when it comes to finding jobs, it really makes a really big difference. And it certainly doesn't make a difference when it comes to fellowships. As well as the pass-fail thing, fellowships don't care. They know that like my school had 80% and above, so they know you're doing good if you passed. They don't really care about GPA, and neither do most employers. So for the pants, my school did a 3-day review with a certain gentleman that did a lot of review courses for lots of programs. Wasn't my style of teaching whatsoever, learning, but they gave us a lot of material. Some people will study for like, I know this is probably like way in the future and you're like, I don't care about that right now. But just so you know, a lot of people can take up to 2 months to study for it. In my opinion, get it done as soon as you can. You have been basically studying for the PANCE for 2 years because during clinical year, and sorry, I'll get back to that, you do take exams. So you're studying for the PANCE your entire 2 years or whatever duration of the program is. So by leaving it for 2 months later, I think that you're doing yourself a disservice because you're going to start forgetting key things. And I know there's so much anxiety on it. I had a full-on panic attack in my mom's car after my exam. I was like, my life was over. It was bad. And then I ended up passing. And I genuinely don't know how to this day how I ended up passing that. But anyway, I took it 7 days afterwards. And I was kind of forced to because my fellowship program that I'll tell you guys about started in November, and my program didn't end till November. So I already was kind of starting late, and they wanted me to like just get in as soon as I can. And of course, after your PANCE, you have to wait for the results, and then you have to wait for your licensing. It's like things are not quick after PA school, unfortunately. So anyway, I recommend taking it. Like I think the good cushion timeline would have been 10 to 14 days to study and then take it, but no more than that. I think the longer out and studies have shown that like the longer out people wait, they don't perform as well. Okay, and for end of rotation exams, the EOR exams I have there, every school does it a little differently, but overall after each rotation, you go back on campus, unless it's COVID, and you take your exam. And it's typically related to that rotation, like internal medicine, you'll take an internal medicine exam. I do the quotations because sometimes it's a bunch of like textbook stuff, but you get a list of all the topics you need to study. You do your Roche review, your HIPPO, whatever, you know, you use to study this stuff. And it's not that bad. Like it's bad, but it's as bad as everything else, but it's not that bad. Hope that makes sense. Anyway, here's like, you know, some of my preceptors. That was my first rotation in pediatrics. The middle one, is a selfie, but it was in family medicine. And then on the right, I actually did internal medicine / interventional cardiology. So we spent a lot of time doing angiograms, angioplasty, echoes, like pretty cool. That guy is the freaking coolest. I've got my little fetal heart monitor on the bottom left one, you know, that was like attached to my hip in OB-GYN, just checking all the pregnant ladies. That was really fun. Got to do some deliveries in that rotation. Some people get more GYN focused rotations, some people OB. Try to get OB. It's fun. Almost dropped my first baby. They put oil on it and didn't tell me, like some oil to help the baby come out. But I didn't drop him. I wouldn't have. I promise. But anyway, the middle one was general surgery, and the last one was psychology. I also did, some are not pictured, I did trauma surgery as well. That was wild. And then obviously I did an ER rotation, which I guess I just wasn't taking photos, but yeah, they were great. This is a Kappa conference I went to, and on the right I got a scholarship from my program to attend a ultrasound workshop, SPOCUS, it's Society of Point of Care Ultrasound. It was like a weekend long conference. It was really cool. They feed you, which for me was awesome. I was in Huntington Beach. Luckily I didn't have to pay for a hotel because it was a short drive and I had friends out there, but yeah, that was great. You know, when you don't know anything about ultrasound, and ultrasound is the way of the world, so all of y'all better learn it eventually. But it's so confusing if you've never worked with it before, and it takes just repetition and like continuing to work with it to get like any sort of comfortable with it, like comfortability. We like practice on each other all the time. So that was like a good little eye-opening workshop. I wouldn't say I learned anything that pertinent since it was brand new to me. And I also even actually Kappa, if you guys are members, that's the California PA Association. So there's one for every state, and I'm sure your states offer it. It's a join AAPA as well. That's our national organization. It's good to have those on your resumes. It's like a small fee, totally worth it. And then join your state one as well, and have that on your resume. It just shows your involvement, and there's so much information you can find on it that's useful about like PAs. You know, the interview questions they always ask is like, you know, where are PAs now, and what, you know, they just ask about like, if you suddenly are like, well, I wish that we could sign Norco prescriptions, and they're like, you can, and you didn't know that, it's like, you look kind of dumb, you know your profession. They like send you way too many emails, but, you know, pick and choose, read a few. Also, they offer scholarships. So I actually won like around $2,000 or something through Kappa. It was like a community service scholarship, and it goes towards whatever you want. So there's not many scholarships out there for grad school, so where there is, take advantage. I think only like 7 people from my program applied to that one, which I find silly. We did a lot of volunteering while in PA school. Most of it was just like on your own terms. That on the left is an Alzheimer's walk. On the right was like a kids fun run. I called it a marathon. It was really a 5K. To me, that's a marathon. That's like the multiple sclerosis mud run on the left, and on the right, this was really cool. My school, usually they go and like volunteer at an orphanage every year in Mexico, but we decided we wanted to build a house. We fundraised everything, like a lot of funds, a lot of things to donate, and we went and built a house for a family, and it was like easily the most rewarding experience of my life. And we go as a whole class. I did get really bad GERD there from all the Mexican food, but it was great. Like literally I had to go to almost had to go to the hospital. It was bad. Anyway, I'm 29 in the body of an 82-year-old, I always say. Okay, so what does a day look like in PA school? My school, and I know some schools are a little different, my school was 8 to 5, like every day, aggressively. Attendance taken. It was awful, because if you were like me and you're not an in-class learner, you just got to get through it. I'm a very like study on my own kind of person. So certain lectures would be my style, others wouldn't, and it was tough for me to get through. Other people loved it and didn't have to do much studying outside of class because they learned so much in class. Anyway, so that's kind of that. A lot of people ask me if I ever had a life like in PA school, like did I get to do things? I would say you'll prioritize what's important to you, and your life doesn't have to change as dramatically as everyone says it does. I think initially I I was studying a lot on weekends, but you start to kind of get the hang of it. You start to know how you need to study, what the exams are going to kind of be like, and then obviously you build on knowledge, so not everything's so brand new. And so throughout the year, I would say maybe about halfway through didactic year, I started really having a social life again and saw my family a lot. So of course it depends how far away you are, but yeah, my family was like a 6-hour drive and I would be able to go a lot. And all of our exams were actually on Friday, which was really cool because even though you didn't find out if you passed till Monday, you could just kind of out of sight, out of mind, have the weekend off, which is great. And as for studying for exams, I'm one of those last minute people where I plan to study all week, but then I don't. So you'll find what works for you. It worked for me, but took time to realize what I kind of had to do. But yeah, you can still have a life is my point. So for the PANS, again, I know this is so long down the road, but hopefully just a little idea of what you're aiming towards at the end of the day, right? It's 5-hour exam, which is totally crap, but sorry, brutal. There's 5 blocks, 60 question blocks. So yeah, after every block, you can take a 15-minute break. But basically your blocks are timed. You have 60 minutes, 60 questions, which is actually really hard because as you'll realize, all of your questions are very like what I call like level 1, level 2 questioning. They give you like a vignette, and then it's not just like, what's the diagnosis? It's like, how would you treat this diagnosis? Or like, what medication would be contraindicated for this diagnosis? And so you have to already know what it is and then know the follow-up answer, which is annoying and why I hate test taking, but whatever, it's how it is. And you get some easier questions mixed in, of course, you know, that you kind of breeze through. But overall, I would say like I was hitting that mark with like 2 minutes left, but I am a fairly average to slow test taker, just so y'all know. And then yeah, you can take your 4 15-minute breaks, but they're self-timed, which is scary because basically if you don't get back to your seat, like you have, how do I explain this? What's 60 times 5, guys? Like 300? Yeah. So you have 300 minutes for your exam, and then they add the 15-minute break. So if there's 4 of them, I assume they add another 60 minutes. So you basically have 360 minutes to do all of this. So you, after each block, you can go take after the first block, you can go take like a 45-minute break, and then you've used up like your breaks, if that makes sense. And you'll get this explained to you later on. But anyway, it's kind of scary, which meant I didn't take my breaks efficiently, which meant I got really burnt out by block 4 and 5. But anyway, biggest thing to tell you guys, I guess, what I want to tell you is how long do you need to prepare for it? Again, talked about this earlier. I really, really think that 10 to 14 days is a good happy medium. If you're someone that wants to get it over with, I would go more towards 10 days. If you're like, oh my God, I need more time, like max 20 days. And you schedule the PANS before you graduate. It's pretty much as soon as that comes out, like they'll tell you in school when you can sign up, because those dates will go. And you take it at any testing center, so you can go home and study, you can, whatever you want. You can go to Mexico and lay on the beach and study, whatever. It's like the only place open right now during COVID anyway, so. And then how long does it take to receive results? So that's the thing. They grade them in like blocks. So say they grade on like, and you don't know when they're going to grade it, but they grade it on like November 1st, and then they're not going to be grading again until like the 30th, and you don't know that. So if you take your test on the 27th, you might get your exam results back in like 4 days. But if you took it on the 1st, on the 2nd, and they're not doing it till the 30th, you might be waiting weeks. So I always tell people, like, plan to wait up to 6 weeks. I think I got mine back in honestly 4 days. And a lot of people I talked to got it in 4 days. So they don't tell you really what to, you know how they just kind of are like, expect this, so that way that you don't complain. So they say expect 6 weeks. It's probably going to be 4 days. But anyway, as far as job planning goes, just know that you might have to wait because you do need to have passed the national boards to even get your state licensing finalized. I think that's true. Sounds right. Okay, so licensing. This is a big one, especially to think about financially. To actually receive your state license, it can easily take up to 6 weeks. they are not in a hurry. They don't care. And if you're finishing like I was in November, there's holidays, and you have to think of that. These state people don't work holidays. They go home at 5 p.m. every day, you know? So take that into consideration when job applying. Now, the cool thing is you can actually apply for it 30 days before you graduate. And then you just send in your PANCE results like afterwards. So what that means is if you graduate November 1st, you can actually apply for it October 1st and do that and get all of your paperwork and everything together before October 1st and then send it in. Because if you're like me and you procrastinate and you wait, then you're just waiting, you're just putting everything off. I ended up starting my program like a month later than I meant to. I kind of did it on purpose. But anyway. So yeah, and the biggest thing to remember here is when you're not working, you're not making money. And if you're on student loans like I was, you're not getting student loans past that last quarter of school. So besides the fact that PANCE costs, I think, $500, you know, and maybe you're paying rent somewhere by your school, and or maybe you're going home in between if you're fortunate. But if you have a family, kids, etc., you basically, from the time you graduate, take your PANCE, get your license, and get a job. And if you're in hospital, get onboarded at that hospital. You can be looking at, like, even if you take your PANCE immediately, you do everything on time, at least 2-3 months before you're starting to work. So biggest thing is just financial planning for that. A lot of people just, their last couple loans they got, like, just put more in savings. I was fortunate to be able to move home during that time frame, so I didn't have that many expenses. As far as paying your loans, you can put that on hold. Don't even worry about that. But just know that, because some people kind of go, oh crap, all of a sudden I don't have any income. They freak out. So yeah, just know that. If anyone plans to work in a hospital, once you get nationally certified, state certified, you have to get boarded at a hospital. That can literally take months on its own. I got mine like sped up because I'm in this fellowship and they can pull some strings, which is really cool because they're on the hospital administration board. So mine took like 2 weeks, but on average, I know people that can take usually a month up to 3 months. So if you're working in like a, you know, private practice or urgent care, you can work urgent care in the meantime. Those are a lot quicker. I had a lot of friends work in urgent cares until they kind of got into whatever hospital position they were getting into just to make money. What else? Anyway, okay. Sorry. So weird that I'm at work right now. I bet everyone's wondering like what I'm doing outside. I'm in like an on-call room. There's like a bed. So they're pretty comfortable, actually. I used to sleep in them for work, though. I used to actually bring my computer and watch Netflix and watch Love Island. Anyway. All right. So post-PA, the part you guys probably actually want to know about. I am in an emergency medicine PA program, otherwise known as EMPA. I'm not going to disclose what program it is. Some of you might know. If you figure it out, it's fine. Just don't say it out loud. More for privacy reasons, and also I like to share random cases, so kind of I always change all the info, but just HIPAA stuff too. There's a lot of weirdos on Instagram. I just try not to disclose it too much. Anyway, my program is 14 months long, unless you're me and you got COVID and you had to extend it. But it's 14 months. 10 months are like specific to the ED, and then 4 months are rotations. All the rotations are very applicable to emergency medicine. So the rotations that we have, a few of these unfortunately got pulled from me because of COVID, but we have pediatrics. We do like a week there. Excuse me, I think 2, maybe 3 weeks in an OB-GYN, which is in hospital, by the way. It's all in hospital. You get a week in anesthesia, which is basically a week of just intubating patients, which is awesome. A couple days we do in respiratory therapy just to sort of learn like vent management, extubating, like stuff like that. I haven't actually had my RT shifts yet. We do 3 EMS rotations. We do it with the local fire department, with the police department, which one of my friends in the program went on like a legit police chase, which is crazy and like never happens. And then one on like an ambulance. Oh, no, so one's a helicopter. That's what that photo you guys saw. One's actually a helicopter. Maybe you get to go up and go pick someone up, maybe not. But anyway, that's what my program does. I don't know what other programs do, but there you go. Then we do a couple surgical rotations, kind of changes, and my program's pretty flexible with like seeing what you want. So like this month I'm on SICU, which is surgical ICU. I'm also doing burns because we have a burns unit at my hospital. So this week I'm on burns. Last week I did SICU. I'm kind of doing whatever I want until someone tells me otherwise. And then you can also do trauma surgery as well. And within that, you're not really going to the OR. I mean, oops. That was my alarm to remind me to go home and finish this presentation and get dressed. Okay, it's fine. Whatever. So, oh, all right. I think I'm wigging out, but there's people coming indoors, and I don't know if this is someone's room. Like, did I take someone's room? I don't know. We'll find out. It'll be fun. So anyway, you do more ED specific stuff. Like, I don't want to go to the OR and do skin grafting. If you're really curious about it, you can totally go. But I do more, I manage the floors. So I'm doing rounds in the morning with the surgeons, and then, well, actually I come in way earlier. I get all the vitals, I get caught up on all the labs, I start my notes, and then I write down everything I need to discuss with the surgeon, and then we round as a group, and then I go put in all my orders, fix whatever I messed up on, which is a lot, always. And then, also at some point see my patients, do any wound care I need to do. However, in this burns unit, we have wound care nurses that do all the, like, burn, debridements and everything, which is great. They're great. And they help me and teach me a lot as well. And then the biggest thing is you're doing ED consults. So anytime someone comes in the emergency room and they call the burn unit, it's actually me going down there, which is kind of funny because I work in the emergency room. So I'm like consulting myself in a weird way. But anyway, I go down, I see the burn, I see if it needs to be admitted or if it's something I can just like bedside clean up and refer him to our clinic. And with SICU, obviously that's not super emergency related, but whenever like trauma activations come in, they're going to be surgical or they're multi-system, it goes to surgical ICU. And then, so I'll go see those consults as well. SICU is a lot of learning outside of I'm like, did I even go to medical school? I swear, like, what is happening? But you learn a lot. Yeah. Trauma activations, any big bad emergencies, basically trauma team goes down. You get a lot of opportunity, I think, to do like procedures like chest tubes and stuff in that rotation. In SICU, you can probably get some of those too if you want, if you fight for them. They do a lot of trachs as well, which I don't know that we even can do those. I've never asked. I don't really weirdly care to, but you can go watch them for sure. And a lot of patients get coded. You can get your CPR in, blah, blah, blah. And then we also do ortho surgery. We do, I think it was 3 weeks. This is super helpful to emergency medicine because knowing when you need to, because the amount of transfers we get from other hospitals for our subspecialties here, because we're a trauma 2 hospital, kind of a trauma 1, is ridiculous. They come into the ED, I look at the report and I'm like, why are they here? This can be done outpatient. And it sucks for that patient who got a fat medical bill and a lot of time wasted and drove from God knows where just to be sent home. So I think it's really, really important to understand specialties, understand when someone needs to be emergently consulted versus when you can just splint them, whatever, follow up. So ortho is really helpful for that. You get to obviously do a lot of fracture reductions, dislocation reductions, splinting. And of course, again, you can go into the OR. I never wanted to go once. I went into the OR a lot as a student. If you're into surgery, then you can on this, even an emergency medicine fellowship, you can get opportunities to still go into ORs, which is cool. Other fun things that got canceled for me, thank you coronavirus, was diabetic camp. My program actually sends us one at a time to this camp in the mountains where literally a bunch of kids with diabetes go, which you can imagine they need some medical personnel, and you are the medical personnel, just you. So you're doing a lot of diabetic management. I've heard from previous fellows, they're actually teaching you more than you're probably teaching them because these kids know their stuff. They're anywhere from like little kindergartners to high school, depending on what week you end up getting assigned. And, but a lot of other things happen. People are in camp. They're going and doing extreme sports. So broken ankles, head traumas, like lots of other things end up happening that you're in charge of. And you have to know, what you can handle and when you have to call the ambulance to take them in. Allergic reactions, anaphylaxis, like it's all happened. So that's cool. We also have SEMPA, if anyone's interested in emergency medicine. That's the Society of Emergency Medicine for PAs specifically, which is cool. We have our own society, because there's ASEP for physicians. They have a really fun thing every year where you can compete in like what's it called? They ask questions and you answer. So tired, sorry. Anyway, you know what I'm talking about. And then you win a trophy at the end if you win. You don't get money or anything, but a trophy is pretty cool. And yeah, it's really fun. It's held somewhere out like every year. It's held like this year it was over St. Patrick's Day in Chicago, which would have been so cool. Whatever, canceled. You can go to Capper conferences every year. We at my company that I work for, that I'm a part of for the fellowship, they have a partnership conference, which is apparently so fun. And we just had to do it remotely, which you guys could probably attest to right now. It's so boring. Although you can sneak wine or something from home, but I guess in person, it's way more fun. You get drink tickets, you get steak, like it's great. The networking more than anything is the saddest part of my life this year, that I'm missing those opportunities, but I have to do it the good old fashioned way. So yeah, you get in a lot of networking through your fellowship program, which is another reason why I'm a full advocate for it. These are just random selfies that I take, because no one wants to take pictures with me, but I just take them myself. Anesthesia, ortho surgery, COVID gear. And then this is just hilarious because I look so awful in my PPE. Oh God, it's not very flattering. So I just thought I would show that out of embarrassment. Okay. And before I move on to like actual emergency medicine chat, what time is it? Okay, we cool. What time is it for you guys right now? 3 hours ahead? Okay, it's been like an hour. Okay. I'll wrap up here shortly, but as far as fellowships go, people ask me like, do you really need one? Do you need to do it? For emergency medicine, I would say yes, absolutely, 100%. We do not have enough training as PAs to go and manage ill patients. By no means necessary. You can go do the kind of urgent care stuff for sure, fresh out of school. You can probably manage some broken bones, some viral infections, lacerations, urgent care stuff, but you really can't handle ED stuff out of school. No one can. It's crazy that that's even expected. We don't have enough experience, even if you chose all of your electives in emergency medicine. So if that's what you want, I highly encourage a fellowship. Yes, there's a big pay cut, but you can manage it. They do pay enough with overtime because it's hourly at most places, actually always. You definitely pay enough to be able to cover your rent. It's obviously a little bit tight, but basically if you were able to do it in VA school, you can do it for another 14 months. And the networking you'll get out of it is incredible. The experience is like no other. No one's going to hold your hand when you start working. You're going to be meant to produce a certain amount of patients per hour, no matter where you are. You're meant to see a certain amount of things, do a certain amount of procedures. And that's kind of dangerous for the patient, in my opinion. I would not feel comfortable seeing a ton of patients quickly until I'm comfortable doing it, right? And when you first start in a fellowship, because they're not paying you as much, they're like, it's cool that you saw one patient last hour. It's cool that you only saw 4 patients today. Tomorrow, or like next week, let's do 6 patients a day. And the week after, let's do 8 patients. And eventually you're going to be up to like 20 really comfortably a day. Depends on the acuity. Some of our other PAs see like 40 or 50 a day. It's crazy. A busy night for me is like 20 to 25. That's a lot for me. But again, it depends on the acuity. But anyway, it makes sense, right? Once you get paid a certain amount, they want you to produce a certain amount. So that's why a fellowship's great. You just get to learn. And most fellowships, I'm pretty sure all are at learning institutions where there's residents. So you get to go to a weekly lecture. We have our own lecture as well as we join the resident lecture. So you're really like treated 100% like a resident. So back to ED life. What is it like? Well, and sorry, meant to say, if you don't want emergency medicine, probably not. Orthopedic surgery would be one exception. There's a lot of really good ortho programs, and I know ortho is a very, very competitive field, so I think that's a very good idea. But if you happen to get a job right out of school in it, then don't worry about it. But EM, just because you get a job in an emergency department doesn't mean you shouldn't do a fellowship. And you'll be wanted everywhere afterwards, by the way. But if you're looking for family med or any like plastics or any other subspecialties, I would say just try to, get the job in it eventually. Just get what you can, network, and find what you want to do. For a lot of those subspecialties, they want general surgery first, even if you're plastics, etc. So you might, kind of just go that route. And again, if you can't find a job in what you want, again, an EM fellowship, it's not a bad thing. Even if you want general surgery, I consult general surgery at least twice a day. You're still seeing surgical patients. You're just not in the OR. And as a PA, you're not going to always be in the OR anyway, depending on your site. You might be more like rounding and on the floors. It's got an Apple Watch, and I don't like it because then you get every notification. Oh, it's awful. Okay. Shh. All right. So shifts, 12 hours, 7 to 7 in the ER. 7 p.m. to a.m., a.m. to p.m. I do them both. I switch frequently. My program, you stay on days for like the week or nights for the week. They try to do it at least 2 weeks at a time. It doesn't always happen that way. So often, like, I'll get off a night shift on a Sunday morning, I sleep, and then I start Monday morning day shift. Sucks. I end up working like 10 days in a row, exhausted. We have pods or zones in my emergency room, and I've never been to an emergency room that doesn't have this. So ours in particular, we have a trauma pod, which is our pod A. We have B and C, which are these high acuity patients. I've seen it in other hospitals as like the cardiovascular patients, patients requiring telemetry and cardiac monitoring. Then we've got our pod D, which we're kind of unique because we're a county hospital and we see all the jail patients from like every jail in the county. So we see all the jail checks, all the prison patients that are too sick to go to their clinic in the jail. And then we also actually get some high and mid acuity patients. Like we get septic patients that code in D pod, which is super unexpected because it's not meant to be that kind of pod. You get a lot of procedures in this pod too. Actually, all of them. And then where PAs primarily are located in most EDs is the MSE, which we call our pod, medical screening and exam area, triage area. Now, it's not that you're just triaging a patient like you're like, what are you here for? The nurse does that. But you're the first provider seeing them, and if they're really, really sick, you're the one calling code strokes, like PAs actually have a huge responsibility when they're working these areas, okay? Because your job is to recognize acutely ill patients. So even though you may not be managing all of these acutely ill patients, you need to know how to recognize it. And so if a patient comes in and you see abnormal vital signs or they just look a little junky, you're not going to wait for their labs to come back to tell you that they're septic. You need to know. And that's when you call the charge nurse, you get a bed in the back. Now that patient has moved on from you if you're working up front. But most of the time, the patients that come through the front door, you see them through and through. You order labs, x-rays, etc. They go wait wherever they wait, IV meds, whatever, and then you go and evaluate them later and you discharge them. So you're still seeing patients through and through. I have literally, in that kind of pod, I have treated DKA and sent a patient home after I closed the gap. So you can still do a lot of really cool stuff from up front. It's also really, really procedure heavy, and I'll discuss kind of what procedures those are in a bit. So I kind of touched on this, how many patients you're expected to see in an hour. Say you're not in a fellowship. If you work for Kaiser, not many. If you work for anyone but Kaiser, I would say 2 or 3 per hour is kind of the expected going rate. Depends on how many, how staffed you are and how many patients your ED gets. Like I said, our staff PAs see a lot because they work up in MSE primarily, and sometimes they're in D-pod. But we have some that see 50 in a day, 60 in a day. Like, inspirations, these guys, man, they're brilliant. There's some people here that are just geniuses. I don't understand it. But anyway, yeah, so you work your way up, especially in a fellowship. I'm hoping by the end to easily see comfortably 30 patients and not be sweating it. So procedures. This is like everyone's favorite thing, right? You will get to practice procedures in your didactic year. Yep. We did like INDs on jelly-filled donuts, which luckily I don't like those, but definitely never will now, at cream-filled donuts. And we had a lot of fake models. My program didn't have cadavers. We had these like 3D cadaver tables. It doesn't really make a difference. When you're in school, you're like, darn, I wish I had cadavers, but every patient when in real life, they're different. They're living, like dead. Yeah, cadavers don't, none of that matters. Don't let that be like the reason you pick a program. For sure, don't let that play a role. Oh, I wish you guys could have heard that. That was good. Okay. Anyway, procedures. Fun stuff. this took me some time. I put a red line to the most commonly performed procedures by PAs. Most of these are done, and we'll go through them real quick, up front from MSE. You just get a room wherever you are. So lac repairs, I'm starting on the right, I don't know why, but lac repairs, lumbar punctures, we get rooms for and do. Nail bed repairs, can't do those, they make me pass out. Any like nasal, epistaxis control, basically. Nerve blocks, obviously you'll do those when you're doing procedures, but sometimes just doing nerve blocks for patients' pain is really, really nice, especially patients with dental pain. Like, it's not emergent. I don't need OMFS to come see you right now. Yes, you need your tooth extracted. What can I do for pain? And you give them a shot of Toradol, and you give them some Norco, and you don't want to be giving everyone opiates. So it's like the best thing is a nerve block, and it's temporary, but it's amazing. I mean, I've had patients like so tachycardic and pain from dental pain. If any of you have had it, it sucks to get like when you need a root canal. And yeah, they get a lot of relief from nerve blocks, and you can bill it as a procedure one day. Anyway, paracentesis, where you go into the abdomen, you go into the belly, you get a bunch of fluid out. Those are really fun. They're really satisfying. Most of the time it's diagnostic. These are patients with like liver failure and ascites if you think they have like an infection. But also, depending on your hospital and if they let you, I like to, you do it therapeutically. Patients will come in really, really short of breath, and it's because they have so much fluid in their belly, it's literally pressing on their IVC and they actually can't breathe. So you take off like fluid, and as you're taking it out, you'll just see the patient take a deep breath and their vitals just improve, and it's very satisfying. Also, you see their belly go like this, whoop, like go flat, which is, I don't know if you can see me. I don't know if you can see the camera, but you see it go down like a deflated balloon, and it's very satisfying. Procedural sedation, you'll need an attending present pretty much always because it can be dangerous. Rectal prolapse reduction, this is a fun one, and what you may not know is if you can't get it back in at bedside, you have to actually, the best thing is you put a little sugar on it. Like quite literally, you go and get a sugar packet from the cafeteria and you sprinkle sugar on the prolapse. And by some osmotic forces, basically the rectal mucosa absorbs the edema that is like prolapse. So it makes the swelling go down so that you can push it back in. Someone told me that and I thought they were messing with me, and I went and looked it up, and it's actually a thing. And it works. I've done it like twice now. But it's always really fun to tell people that that's what you do. So when you're in class next year, just be like, oh yeah, just put a little sugar on it. And your teacher's gonna be like, what? And you're gonna be like, PA Pappas told me. Works. Don't try it at home. Reduction dislocations, these are fun. When people's like, for fractures, I don't find them as fun. They are like rewarding, because when someone's arm's like really messed up and you put it back into place, it's pretty cool. But people are in pain. I don't like it. But dislocations are awesome. Putting a shoulder back in place for someone and they get pain relief immediately is awesome. Hip reduction, I can't actually do to completion on my own because I literally don't weigh enough, and I'm like 5'7" and I weigh a good amount, but it requires a lot of strength. But I can get it like halfway. It depends how big the person is. It's usually like these huge dudes that get their hip out in car accidents. Okay, all right, I'll speed up, sorry. Okay, arthrocentesis, that's when you get fluid out of a joint. That's usually for to diagnose something. Burn debridement, hey, that's me this week. But if you can get comfortable with burns, you will be, especially as I will, like you'll be the go-to person in that entire ER, because people freak out with burns and then they refer them to a burn center. You don't need a burn center half the time, majority of the time. Blah blah, eye exams, whatever. Felon paronychia drainage, just like abscesses under the nail, like the opposite side of the nail on the fat pad. Foreign body removals, G-tube replacements, like when someone comes in with a peg tube, like you just swap those out. That's pretty fun and satisfying and really easy to do. INDs, if you're into some pimple popper stuff, hernia reductions all the time. And then less commonly a little bit would be like intubations. That's more in the back of the ED. Again, did them on our anesthesia. I did like 11 or 12 maybe during anesthesia, and then I get them occasionally in the ED, but we all fight for them. So they're hard to get. And some other ones would be like ring removal, splinting, subungual hematomas. It's called trephination. You get these we have these pens and it heats up at the end and you just tap it on the nail when people have like that bleeding under the nail. It's because it's so much pain for them, and you tap it and it makes a little hole and relieves the pressure, and the patient feels so much better immediately. To me, those are the procedures that are the most satisfying, when like the patient feels better. Thoracostomy, that's a chest tube. You likely won't be doing a thoracotomy where you open the chest. I've heard of someone doing it before. I don't even know if that's in our scope, so I would be cautious, but they're fun to watch. And those patients are usually already. But anyway, ultrasound, you better be doing that. That's why that arrow is so big. Hopefully you're not doing any baby deliveries in the ED, though I'm sure it's been done. Yeah, I think I hit most of them. Central lines, those are fun. Femoral lines, internal jugular, subclavian. Or you can do arterial lines too, just like the same thing, but blood squirts, harder and way more dangerous. So you can't mess those up. Which of course my first femoral arterial line was in a COVID patient, which means limited people in the room. And we didn't have room for the ultrasound because the vent machine was in there. So I went blind to do the central line, which somehow was successful, which is great. And then, it's just next to the vein. So I tried to do the femoral. I got it, but I had to have some assistance from a resident because I was freaking out. I was like, and she didn't have a pulse, so I couldn't feel the pulse for the arterial line, which is, what's most helpful. But unfortunately, half the time you're doing these things, it's because patients are pulseless. And then this slide, nothing, because that's it. So yeah, what else? My hours in SICU, which is what I was going to explain why I'm so tired. I hope I didn't mumble too much. I come in at 5 or 6. I leave at 8 or 9. And it's exhausting all day. I definitely haven't even eaten lunch today. But anyway, I'm actually liking it though. My team's great. The residents are great that I work with. But I'm going to stop this sharing. But I am just really tired. So I apologize that wasn't more put together. I was going to elaborate more on ED, but I'll just take all your questions. I think that blah, blah, blah. Okay, let's see. Someone's pre-med, curious about pre-A route. I was pre-med too. I was pre-med all the way halfway through college, actually. Your major does not matter. If you don't already know that, your major does not matter. It's very nice if you are some sort of science major because you need to get the prereqs done anyway. So don't torture yourself and have to do all of it twice. But if you are crazy passionate about something else, that's fine. What else? Did I take a gap year? That's what I was kind of talking about in terms of just applying to see if you get in that 1 year versus waiting until you're really, really ready. This offends some people when I say it, so I apologize if it does, but I don't really want a 24-year-old in charge of my patient, of me. If I was going in at my age and there was a 23, 24-year-old, not that you know that, and to be honest, even if you are, people probably don't know it. But even at 29, I get told how young I look. Probably not right now with these crazy under eye bags, but anyway. Just think about it, right? Would you really want your mom kind of managed by someone that young? And when you think of any new doctor, they're at least 28, 29, right? And that's why the average age for PAs is that age, because you need to get experience. It's the whole point of our profession. And so people kind of slide into PA school because they had these shadowing and these volunteers and they did this and that. And so they kind of met those hours and they got in. But the point of patient care experience isn't to put a number down for example, GPA is. That, you just want the number down, right? For shadowing, you maybe even just want the number down, whatever. But for the experience, the whole point of doing it is to learn something from it, right? So pick the things that you're going to learn from. I recommend scribing 100%. It may not fall into that exact category that you're looking for and you need something else with that, and that's fine. You don't need to go get certified in a million things, though. If you want to get ENT certified, that's really cool experience as well. But take something out of your experience, don't just go through the motions. And I think to get adequate experience in medicine, but also in life, is really, really helpful for PA school. Because it's a lot, mentally, physically, emotionally, it's a lot. So you don't really want to go in before you're ready. And guess what? you know what comes after PA school? Working, which you're gonna be doing for the rest of your life. So if you have the means, I know some people, everyone's in a different point in their lives. If you have the means to take a gap year, I 100% recommend it. But I don't just recommend a gap year to get experience. I recommend like a legit gap year. You want to be doing something because they're going to be like, what were you doing? But I went to Peru. I went to Peru to volunteer as an EMT. I worked in a hospital in the middle of nowhere, almost died multiple times, which if you guys want to do that, I'll talk to you about what to do and what not to do. Another time you can slide in my inbox. But, I got a lot of travel experience. I got a lot of like life experience, just did a lot of things that I wouldn't have done had I gone straight to PA school. Okay. Cause like sometimes I'm already looking to retire right now and I'm not even in my second year of working. So take your time if you can. And yeah, I moved back home for it, which was awful, to be honest. I mean, I love my family, love my mom, but you don't really want to live at home again after you hadn't been for so long. But now retrospectively, I don't regret it. I got home cooked meals. Really, it was nice. But yeah, definitely take a gap year. Hope that helps some of you decide that. And even if you don't want to travel the world and all of that, then which I can help you do very, very cheap. I barely spend money when I travel, and I do everything. I don't rough it. What else? Yeah, I'm sure hours are really tough with COVID, but schools will adjust that. Like they have to. Like, yeah, or they're not going to get any tuition next year. So I'm sure they're going to adjust things appropriately. Okay, I think I was asking you guys questions throughout this because I'm seeing like yes, no, yes, and it's kind of funny to me because I'm like, what did I ask? It wasn't scrolling like this when I was talking. Blah, blah, blah. And yeah, as for shadowing, how many, if someone can hold up a finger, like how many hours do you need? Or like experiences? Do you need like 4 times of shadowing? Is there like a number or you just want to do a bunch? Because this changes every year, which is why I'm asking. As you probably know, if you guys haven't applied yet, go on the CASPA website. The information for everything you need is on there. PAEA is also really, really good. I forget what it stands for. But they have so many good resources as well. So, oh, all right. And I'm not advertising this because I don't get paid by this company, but I heard my PA box is really good too. They're on Instagram. You can search that. I think that's what they're called. And if you don't get in your first time, it's okay. I had plenty of people in my class on their third try with grades that were way better than mine. So, but I did notice it kind of came down to experience at that point, and interview skills, which, I definitely fudged my first interview, but I practiced a lot and I want to do interview workshops with you guys as well at some point. I've been wanting to because I had a pretty good method of it. When are interviews? Like what month? We're kind of in applications are getting turned in time right now, I think. Interviews, oh no, they're already turned in. Interviews are probably coming up. Or maybe you guys aren't even there yet. Yeah, interviews are coming up. Okay. All right, we can get more interview specifics soon then. I'll tell you right now, practice answering a bazillion questions to a stranger and then practice to like your mom or something. Like I printed like 400 questions and had my mom read random ones and me answer them multiple times every day for weeks. And also, just a sidebar, have like a bucket of stories to choose from. Pick a couple life experiences that you feel like you can pull good traits out of. Like I picked a time in Peru with like a little girl that I was treating in the hospital, and it was more of like a social interaction and like a heartfelt interaction than actual medical interaction, but I was able to pull a lot of like things out of it. So just have like a bucket of ideas, but I'll dive into that later. Did it become easier stomaching seeing open heart surgery? Actually, the OR nurse, who was this little Asian lady, like older woman, freaked out that I was going to be shadowing. And like I stood where the anesthesiologist stands at the head of the bed, and I was like peering over, just kind of watching, hands behind my back. I guess a medical student passed out, fainted at some point before me recently. So they were like tripping out that I was going to faint. I was pretty sure I wouldn't, but I've never seen an open heart. So how can I really know? And so I was kind of nervous just because everyone made such a big deal of it. And then at one point I was like asked like, oh, well, when did the student pass out? And it was apparently when they cracked the chest. Surprisingly, it wasn't gross to me. Unless something goes wrong, it's not really this crazy bloody mess in surgery. Like it's not, unless you're in trauma. But other than trauma, it's not really this crazy bloody mess. Like things are pretty controlled. You're suctioning, you're like boving things. You got this little cautery thing that you're every bleeder, you're, tying them off or whatever. It's not like Grey's Anatomy, guys. Although I did learn a lot from that show, but it's not like Grey's Anatomy. If only though. If only you had one patient in a 2-day period, that would be nice. God, I wish this was in person. I hate Zoom stuff. All right. Was the pants heavy in one subject more than another? Everyone says that it's distributed. They tell you the percentage of what category things are in. So I think cardiovascular was like 12%, pulmonary was like 10, like eyes was like 4%. So supposedly they go by that. But what I've noticed, and I think there's an explanation for this, is I thought it was totally one-sided on certain things, like way more heavy in certain subjects. But what I've come to terms with is it's really the questions that you didn't know and the ones that you stumbled over that you remember, and the ones you knew you really never remember. So you walk out going like, God, that was all dermatology and like congenital heart disease. And it's like, no, you just didn't know those topics as well as you thought. So I think they have to make it based on their percentages, just for fairness. That said, I know there's 6 versions, and last year, and in most years, there's always a couple harder versions. Because I know people on the board that do the grading, and they're like, yeah, there's 2 versions that were stupidly harder. Whatever. But I still passed it, and I thought it was ridiculously hard. So I think, honestly, if you do what you need to do, you passed your PA school, like you're going to pass the boards. It's not that much different than all the testing that you have during school. Just longer. What kind of courses did I take to prepare me for PA school? Was it necessary to take OChem or physics, general bio, all of that? You have to. There's prerequisite courses you have to take. And you can go to individual program websites if you want. PAEA is actually really good about, once you type in, like, it makes you type in like a region. You could put California. You could put GRE required or whatever the test is called now, or not required based on if you want to take it. You can put the duration of the program, like you can filter it basically. And then it'll come up with all these programs. And when you click the programs, it takes you to like this page of what's required. And it'll say how many hours is required, how many letters of rec, what classes are required versus recommended. Like recommended means required, let's be honest. So if it's recommended for a program, do it. So yeah, you do need all those basic science classes. I took organic chemistry. I'm pretty sure most schools require it. I really liked it. I feel really smart. Do it. I think physics too. You definitely have to do anatomy and physiology with a lab. So UC Santa Barbara actually got rid of our anatomy lab program, which was so lame right when I started it. So that's why I did it at a junior college afterwards. But it worked out really well because then I ended up working in the cadaver lab for a couple semesters just because I loved it. That sounds really weird out loud that I loved working with cadavers. I'm not like morbid, but anyway. All right. How many hours do I work per week? In the ER, I usually work anywhere from like 52 to 60. And then here on SICU, I've been working like 70 plus. Surprised no one's missing me right now. I'm really glad, but the nurse came and told me a patient was like desatting on oxygen right before I came. And I was like, all right, just do this and then get a chest x-ray. I'll be back. And I figured they'll call me if they have to. So it must've been okay. All right. Because my attending definitely goes home by now. They're reachable by phone, but we don't typically need them. And then everyone else is in the OR. Okay. Have I worked in other specialties before ER? Besides in school, no. I did a lot of shadowing in ortho surgery. I do like surgery, but the OR is just not my favorite. I wouldn't be totally opposed if I worked somewhere that I really liked with a team I really liked, but I just like EM. You see everything. It's great. Have I performed surgeries? Not by myself, but I've yes, I participated and done a lot in surgeries. One general surgeon let me like help sew a bowel for an anastomosis, which is like severing the bowel and bringing it together and putting it up to the top for a colostomy bag. That's not the scientific terms, but whatever. Yeah, I've done a lot in surgery. And then sometimes when there's bleeders and there's a lot going on, like it is all hands on deck. But honestly, in the ED, like I've had to tie off arteries, I've had to tie off veins. I didn't, to be honest, know what I was doing at the time. It's just like there's a thing bleeding there and I have yarn and I need to fix it, or suture material. But so it's kind of crazy what you do in the moment without even like ever being trained for it before, really. My favorite rotation was definitely my ER rotation. I got to do a lot of procedures. I was at a trauma hospital. But my second favorite was actually OB-GYN, because it was more OB focused and catching babies. There's nothing like it in this world, I think. And then the rest of it's kind of gross to me. So I don't think I would do it forever, but miracle of birth, guys. It's beautiful, right? Where do I recommend learning, reading EKGs? lifeinthefastlane.com or dot something, life in the fast lane. They go through all the EKG basics. You can get, there's like hundreds of thousands of EKGs on there. Not that many, but there's a lot. I'm still going through it myself. And by the end of this fellowship, I plan to do every single EKG in that thing. If you want to look at it, EKGs. Otherwise, don't worry about it. Someone joined APA, don't really know what to do on there to be involved. Finding PAs on social media more involving. Yeah, for sure. AAPA, as of right now, at your guys' point, honestly, if there's big bills that are passed, like political kind of things, I would stay up to date on that, especially for interviews. But other than that, there's not much you need to do with AAPA. Sign petitions when they want you to. It's definitely more just to show you're involved and support our organization with our fees. Someone did a 6-week EKG program. Nice. Yeah, I mean, anything you do before, a lot of people want to study before they start PA school. Don't do that. Honestly, don't do it. Unless you're just crazy passionate about a subject, like you're going to have plenty of time to study. I was like in New York and Montauk before, like 3 days before I started PA school, just eating French fries. Sorry. Apparently it's sign out right now. And if any of you like have to sign off and go to bed or do whatever, like I won't be offended, by the way. Just trying to get through these questions. I talk a lot, don't I? Especially when I'm tired. Oh, how annoying. All right, what made me decide to go PA route? Probably the same reasons you guys are. I want to do other things besides medicine. I love medicine, but it's not my life. And like I said, there were people through PA school that studied every single weekend, every night in the library. And while I did that initially, my social life is really important to my mental health. Doing all of those things is really important to my mental health. I can't just be a bookworm. It's not me. It never has been. Some people can focus like that, and I envy those people, even through my fellowship. They're like, yeah, I did all the assignments. And I'm like, oh, haven't done any since January. And it shows. They're better than me, for sure. Like, they are. They're smarter. It's fine. I'll get there in my own time, because my mental health is equally as important. So it's a big part of why I became a PA. Not that you're unhappy as an MD, it's just not for me. And there are moments it's frustrating, especially because the world does not understand what we have to offer, but just got to do our best to change that. But overall, I'm pretty humble. You know, if I don't know something, I go ask someone. It's like not really a big deal. Even if I was an MD and I didn't know something, I'd go ask someone. Some of these are the same, so I'm just kind of reading through. What are the most relevant transferable college courses? Anatomy and physiology. Because, you know, you got to understand that. Pay attention in physiology, by the way. Not that I didn't. Okay, I didn't. But pay attention. It's good. It's great. ER tech jobs, those are definitely great for patient contact hours. Mm-hmm. How much debt did I accrue? Ooh, personal question, guys. I don't really care to keep that a secret. A lot. I I had like 30 from undergrad, which was pretty decent considering I went to UC. And then a lot from PA school that just kept going with interest. So I'm at like 220 in the hole. Yeah, I saw some eyes go up. Yeah, I do know a lot of people that are much more closer to 140, 150. Whatever. It'll get paid when it gets paid. I actually don't plan to dump on it like a lot of people do. It's really not financially smart because you can refinance these things at like 2%. And most of your credit cards and everything else in your life is a lot higher of an interest rate than 2%. So I'll be paying barely over minimum for however long it takes, unless I win the lottery or marry rich. You can make much more on the stock market, investing and doing lots of other things. Like I have really rich, wealthy friends that have student loans. And the other day I was like, I don't understand why you have $150K in your USC student loans. And I know you make a lot of money. Like he flies private jet everywhere. He's like, he can't refinance them for less. I don't know why, but he pays 6% interest on his student loans, but he makes 14% of that in the stock market. So he's coming up 8% every month by not paying them off. It's anyway, like basically the money he would have used to pay it off, if that makes sense. Anyway, all right, finance stuff. Worry about it later. Actually, no, that's actually probably a good thing you guys should look into now. But they don't teach that in school. Something about outbreaks getting worse. Like, my ER is apparently a big COVID hospital. I barely see COVID anymore. We're getting way better at managing it. Patients aren't needing to be admitted as much. Those that are sick with a lot of other things. So if any of you out there are scared, don't be. Wash your hands. Like, I feel like that's so weird that we have to tell people that, first of all. Why aren't you washing your hands already? Whatever. I mean, you're not the people I have to tell that to, let's be honest. There's probably at least one person on here that just went to like use some hand sanitizer. That was like, oh shoot, I forgot. All right. Someone was like, oh dang, I thought this seemed advanced. I'm a junior in high school. So, wow, you're ahead of the game. That's cool. Plan ahead. Someone else talked about gap years. For sure, I'm a fan. Autonomy. How does PA differ in autonomy when it comes to research, investigations? I don't know what that means. And what about management positions? There's really nothing you can't do as a PA that you can only do as an MD. And if there is some barriers, you can get your doctorate pretty easily. I was going to do it this year, but I really just want to like start making money and be out of the school zone for a little bit. So I'm going to do it a little bit later, probably in like 2024 maybe. You can do it in like 12 months if you want, but I'm going to probably do it more in like 2 years just to not cram it all in. But you literally don't need it. The doctorate's more for research. Don't want to do research. Or maybe like if you want to be the dean of a school, but you can teach with your regular master's for PA. You can be lead PA at a hospital. You can be on the board. You can run a fellowship program. You can do like literally anything. And you can still participate in research. You just may not be the lead. You can even, depending where you work, you can even have your own clinic and just have someone on to like co-sign. But now that law is kind of getting uprooted anyway. So honestly, the barriers are not as heavy as you would think, and they're changing annually, and they will continue to keep changing in a good way. That said, I don't want us to be completely autonomous. Nursing unions and nurse practitioners are fighting for autonomy, and I won't get political here, but a lot of other PAs, pretty much everyone I know, does not want that. We didn't become PAs to be autonomous. We became PAs to work with physicians. I don't claim to have the knowledge they have, the experience they have, 100% no. The amount of like I don't want that on me. That's why I became a PA. So it's kind of scary to see people kind of fighting. Basically, no PAs are fighting for autonomy, but nurse practitioners are. And because we're all grouped into this mid-level, aka advanced practitioner, what the nurse practitioners do and what they win over in terms of the law affects us. So if they become autonomous, it's like we're kind of have to as well, which we all really hope it doesn't come to that, because we're a lawsuit waiting to happen if we do that. No one's going to want PAs anymore. There's just going to be like a new profession that comes in and kicks our butt. Have I ever had an experience in the PA-ND complex with explaining to your patients my skills and wonder if I should have done ND route? I feel like I've touched on that. I feel like I work in a county hospital, so they don't care if you're a PA, a nurse, a doctor, as long as you're helping them. But I know like some bougier hospitals, people will be like, I want to see the doctor. And I'm just like, okay, bye. I don't care. And usually I go tell the doctors that, and most of the time they're like, okay, well, they must not be dying. They can wait. And then they can just wait, to be seen because the doctor's busy. Because we PAs see more patients in a day than any of the doctors do. In my ER, we see like 60-70% of all the patients that come through. PAs do. We see a lot more. They handle the more critically ill, but we see way more patients. Now, okay, I don't know where we're at with time because I started late.
Really quick, I think, are you okay to wrap up questions like in the next 5 minutes, and then we'll just talk about the certificate and then we'll be done?
Yeah.
All right, cool, yeah, thank you.
I actually have to get to sign out anyway, so that's great. Okay. Don't know any cardiology fellowships, someone asked. I can't talk about cases I'm currently working on. I can say that burns is pretty crazy. It's really sad when you get little kids, depending on what the cause is. I've had to call CPS a number of times throughout this year. Child Protective Services. It is our duty to report. You have to be careful. You don't get in trouble saying too much to police officers, though, and investigators, because you don't want to be taken to court saying something. You just give the facts. That's it. How important is PA schools and where you get to work? I don't think it matters that much. Not really. It matters you as a person more than that. And yes, PAs can jump from specialty to specialty. Scribing was 100% the greatest experience you could get. Someone else, I feel like answered someone else's question here. Everyone fill out the Google form. Oh, cool. I think I just scrolled to the bottom. I'm sorry if I missed some of your questions, but there was so many to scroll down. So good luck with your interviews. If you guys want to DM me, if you guys want to do an interview workshop soon specifically to that, I'm willing to do that too. I've got to go sign out these patients and hope that everyone didn't just die or near die, because we handle the sickest patients in the hospital here in the SICU. So it's cool, but kind of stressful and crazy. Nice to meet you guys. Thanks so much. I'm sorry for, this. Next time we'll be a little more organized. Bye. Do I just leave?
If you're ready to, then go ahead. Everybody else, if you could just stay for half a second.
More than half a second. Let's stay. Okay. Bye-bye.
Thank you. All right. Really quick before you all head out, thank you so much for being patient and waiting and for listening. I'm going to send out the Google form one more time. Even if you filled out the Google Sheets in the beginning, please fill out the form. We're having problems with other people just deleting random things on the Google Sheets, so this way no one else can edit it but you. And since you all were live attendees, you'll get a certificate today. And if you want to go back, maybe you missed her say something, or you want to hear what she had to say about something else, we're going to upload the recording to YouTube sometime soon, within the next week for sure. Probably over this weekend. So thank you guys so much for coming. I'm going to put our socials on the screen, and then you guys are free to go. Just let me know if you have any other questions. Thank you guys. Bye-bye.